Hi, everyone, and welcome to CE Institute. My name is Selena Belisle, and I am the founder and one of the board approved CE providers here teaching oncology massage and bodywork. And today, what I'd like to share with you is just a simple Swedish technique. It's also considered Lomi, it's a wave. Working back and forth across the pectoral wall, which is great for breast cancer survivors or lung cancer survivors too. Anyone who's had radiation to the thorax usually appreciates this technique. It's a nice long flowy technique from deltoid to deltoid underneath the clavicles and above the actual breasts themselves, okay? Please make sure that you are not practicing massage on cancer patients and survivors unless you have completed specialty oncology training. Also, we are a CE provider. That means we're providing continuing education to people who have already completed rudimentary training and are licensed healthcare providers. So, in order to practice oncology massage or body work, you should already have a license to practice healthcare, such as massage. Massage is part of healthcare. And you should also have specialty training in oncology because there's special contraindications and precautions that need to be used with cancer patients and survivors as well. Before I show you just warming up the pectoral wall in a really nice stroke that you can practice on breast cancer patients, on lung cancer patients, and so forth, I will show you that we do offer oncology body work here at the school. It's at ceinstitute.com. If you purchase one of our home study courses, you will get an email and instant access to our oncology massage and body work training. Okay, and you can access that 24 hours a day, 7 days a week, until your course access expires. So it's pretty easy to get oncology training with us. And we teach live webinars and live in person in classroom oncology classes as well. So hopefully you are already oncology trained, or maybe you're just looking at this because you're interested in working in oncology. That's great. We hope you come and see us, or make sure you get educated with another provider if you are going to work with cancer patients and survivors. So without further ado, let me show you that hands-on work. So we recommend sitting while practicing this, but in this video here, you're going to watch me standing simply because I was recording this outside during COVID. So what we're going to do is start from one shoulder to the other. My fingers do go underneath the sheet a little bit, but I'm keeping that sweetheart, like the two fingers together, pointer and middle, underneath the clavicle, kind of over the pectoral wall, not directly over the nipples, and just back and forth. It feels really nice. Okay. And this is a nice way we can just kind of warm up the pectoral wall, do some nice Swedish strokes back and forth. I've seen women pounding their chest after radiation and so forth. They are sometimes very unhappy with their soft tissue and the pectoral wall after cancer treatments, which is really unfortunate. They survived breast cancer, but now they're very, very unhappy with how their body feels. And that's just a really nice way to loosen up, feel good, and enjoy body work for cancer patients and survivors.